Welcome back to Tales from the Lab, a veterinary podcast. As you may have noticed, we've made some exciting changes around here. I am your new co-host, Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antech. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Tales from the Lab is a production of Antech Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.
Just a quick note before we jump into today's episode. Our guests today are Tammi Lesser and Michelle Evason, who are employed by Antech. We're sharing this so you have full transparency about the relationships involved.
Welcome back to today's episode from Tales from the Lab. I am your co-host, Dr. Holly Brown, the Chief Veterinary Educator here at Antech. And I am so grateful today and excited to be welcoming two guests. We have Tammi Lesser with us and Dr. Michelle Evason. I will start with some brief introductions, and then we'll talk about the content for today and ask some questions. So Tammi Lesser, as many know, the regional president here of Mars Science Diagnostics North America, where she leads business growth for Antech Diagnostics. Tammi joined Mars in 2020 as marketing vice president for Antech, and in 2022 took on the role of sales and marketing vice president, bringing a dynamic combination of strategic leadership, deep industry experience, and commercial excellence to improve our customer reach in North America. Tammi literally grew up in the veterinary space, so she began her career as a licensed veterinary technician in New York for VCA, later working in critical care in Florida at a hospital now operated by Blue Pearl. With 18 years of experience in various sales and marketing roles within the veterinary diagnostic sector, Tammi has established a strong track record as a business builder, marketing expert, and team developer. So welcome, Tammi.
Thank you. Great to be here. Really happy. Thanks.
And we also have again Dr. Michelle Evason. For those who haven't heard her bio before, she's a veterinarian, board-certified internist who serves as the Global Director of Veterinary Clinical Education for Antech Diagnostics, Mars Pet Care Science and Diagnostics. She has worked in general practice, academia, specialty clinical practice, and in the animal health industry. She's published on numerous infectious diseases, antimicrobial stewardship, nutrition, spectrum of care, and a variety of veterinary and pet owner education-related topics. She keeps busy and quite humble with two teenage daughters, one husband, multiple four-legged creatures, and numerous imperfect projects in various stages of completion in her farm on PEI, Canada. Welcome.
Thanks, Holly. Super excited to be here, especially with this girl power crew.
I do feel that way.
Yeah.
So very excited that our topic today is looking at a little preview of VMX and the education that we are delivering as Antech in this year, 2026. So I wanted to start with you, Tammi, and ask for you, what are you most excited about at VMX?
Well, I think this is like my 23rd, VMX NEBC for people who have been around. So there's always so much going on. So it's hard to pick a favorite, but I always enjoy seeing the Antech booth come to life on the exhibit floor, seeing the pride and all the associates as they speak with VMX delegates and our customers, and really how they bring the products and services to life there. You can touch them, you can feel them, you can really see the impact that we have every day. And just talking to our customers, the veterinarians, the technicians, all of the support staff that's there, it energizes me and really fills my cup.
Yeah, energy is actually the word that came to mind for me as well, right? Our shared energy together and collectively all being together.
Yeah.
Right? What an opportunity for a business that has so much remote work, right? When we get to put all of our efforts together and a lot of celebration, right? When we finally get through the meeting as well.
Yeah, so many people coming together all in one place. It really connects us. I see people that I haven't seen in usually years, and also just appreciating all of our customers again, and partnership that they have with us, and they always thank us for so many of the contributions that we're making when we launch new products and things of that nature. The other part that I have to talk about is our educational events. And man, what a great calendar of events that we have this year. It's so important to educate. So we're there to show off all of the new innovation, but to really double click into the clinical utility and the outcomes. We have a lot this year on GI parasites, obviously with the innovation that we've had there. And then vector-borne diseases is another big area that we have. I don't even know how many sessions on it, but it was so exciting. And some of the names were so cool. The titles were really neat. So yeah, and about vector-borne diseases, we also have a live podcast going on, which is also super exciting. We've got Dr. Jimmy Barr from Antech, and also Dr. Megan Gahuli from Banfield, which is super exciting. I know Megan, and we work together quite often. So, they are kind of guiding us through all of these crucial topics on pet health, which is really exciting too.
Yeah, a really neat opportunity for us to bring our research to life, right? To bring that onto the stages and deliver it to our customers. And as you said, I think in the booth and being on the floor, capturing the voice of our customers and having those conversations, right? We work so hard behind the scenes, right? And our innovation each year and how we hope to develop these products that can be put into use, right? Day one with the education to use them properly. And when we get to put that all together in front of the customer and have those conversations, it is very exciting indeed.
Yeah, rewarding.
In speaking more to the education and, of course, your investment in that, can you speak more to some of the programs, both at VMX and the upcoming ones that help shape and help Antech grow as a business?
Yeah, I think it starts, a lot with the innovation, and can it be innovation that we've launched, a few years ago, like KeyScreen is a good example, where we've got a really great differentiated product that brings new insights into the veterinarian's hands. And then what do we do with the results? So it really makes me proud to see it's not just, the placing of the product, but it's really how to interpret the results. How to bring that information to the veterinarian. So if they have questions, we kind of, in a way, bring the 401 university section down, and you can take the 101 or you can take the 401 and really go deep on the innovation. But it really starts, I think, with the innovation, what's top of mind, and where the problems are from a clinical perspective from our customers, and how do we kind of help them to guide them through those clinical outcomes that we all want to see.
Yeah, and we are so lucky that we get to capture a lot of where the problems are, a lot of those questions from our customers through our consultation line, right? So a group of experts in a variety of fields, obviously internal medicine being the largest of those, but they field over 800 calls a day from our customers, right? So we get to learn firsthand from our customers where they're struggling in making appropriate diagnoses or in treatment regimens, and to be able to put that together and be able to answer some of those questions and bring them to life through our diagnostics, but through our education, right? So we have success of these products so they're used properly, right, to help the pets, right? Our ultimate goal on this. Yeah, I love it. And I capture a quote from Katie Devine that she had said last week at a meeting, hearing her say that effective treatment begins for any patient at the moment of an accurate diagnosis. And the sooner you know what's going on with a pet, the better the outcome and the lower the cost of care. And I thought that was an interesting addition, right? So, as a clinical pathologist, I'm thinking, right, we just got to get the right diagnosis, right? But it's actually goes well beyond that, right? It's our communication around that. And it's about having the right conversations. And that's a great transition to speak to you, Michelle, because I think that you've made that such a priority in your education initiatives, is making sure that we communicate effectively and we meet our pet owners right where they are at, so that we can be the most effective in our diagnostics that we offer and in our treatment outcomes. So I'll transition to asking you a couple of questions, Michelle. And so for those who don't know, you are the wizard behind the scenes that puts together our education platform for these big conferences. And the wizard doesn't really call it correctly. I think as we all might remember, that Adam Chrisman last year on his podcast had actually coined you the Taylor Swift of VMX, that somehow you have corralled. I know, that's an impressive title, right? That she had corralled all these great KOLs, paired them with some of other educators and some of her internal talent, and here at Antech to put together really a star-studded performance in the education venue. So if you could speak a little bit about your role in developing the education platform this year.
Thanks, Holly. I'm happy to. To be clear, and as you mentioned earlier, I have 2 teenage daughters, and so I really enjoyed telling them that Adam had referred to me as the Taylor Swift, because you might imagine their very rapid response to that, which was not quite as flattering as Adam was. Right? How you stay humble and also connect, right? Because I think one of my very favorite parts of my position here is doing exactly that, which is putting together these programs. And part of that is because it really makes me feel like I have the opportunity to give back to this profession. And I try to do that by being very, very clear on who our target audience is, right? And it's clinicians and veterinary teams. And ultimately, behind that is what all of us, the 3 of us that are here today, and also everyone that comes to the sessions and walks by the booth, is to do the very best that we can for pets, right? And so, that's really what these are. As you mentioned, Holly, we have the benefit of our Antech consultation services, so internal medicine and also imaging, and we get to hear firsthand what challenges veterinarians have. And so we really have a great grasp on what they're wanting to receive help on. And so I try to design the sessions for that, toward that end. And I also, every year, I'm privileged to be provided with some big themes to work with. Some of these heading into 2026, and which will be spotlighted at VMX, are around preventive care. We all talk about treatment and being able to make that diagnosis and detect. But I think even more than that, what I find impactful, and this is kind of a funny thing, being an internal medicine specialist, right? It's that sexy thing to chase the disease. But what I find even sexier these days is preventing a disease from happening, or being able to detect it earlier on so that we can provide a better prognosis. And I will echo Katie as well, because that does ultimately bring down the cost, and it also allows access to care, right? We can treat more pets, and we can help more pet owners if we're seeing more dogs and cats come into the clinics. And so the big theme for this year is not only preventive care, but it's also around contextualized diagnostics, right? So we know that veterinarians need options, and so do pet owners. And we really want to be able to, and I feel really proud that Antech has allowed me to do this, is work to meet veterinarians and veterinary teams, right? I would be remiss if I didn't include technicians, nurses, as well as the entire clinic staff from the front end to the back. They need options so that they can have these conversations with all pet owners. And that's always about the context, right? As we know, that's what spectrum of care and contextualizing spectrum of care is taking that unique situation, which is the pet, right? Every pet is different. And as we know, every pet owner is different, especially when you start talking about cats and cat owners. And also every clinical setting is different. And so that does require different options. And I'm really pleased that at Antech, we're able to meet veterinarians with a variety of options, right? Tammi mentioned vector-borne disease. That's going to be one of our very big themes in and around preventive care at VMX. And so we're able to provide veterinarians with a toolkit. And also, I'm really pleased that we have a lot of research to back up those innovations that we have. And so we'll be spotlighting some of those. One of the other things that I really, again, back to our target audiences, I feel strongly about, and I know you do too, Holly, because of course, a lot of the credit towards these programs goes to you, my friend. So thank you for that. But one of the things that we both work very hard to do is when we're doing education, and all of the speakers that we have joining us and at VMX will do this as well, is put all those things in the context of what's happening in a veterinarian's day-to-day, which is the case. right? And so all of the education we'll be providing will be on specific topics like vector-borne disease, but it will be in the context of a case, right? And a specific pet owner. So big themes: preventive care, contextualized diagnostics, as Tammi mentioned, things like fecal diagnostics, which are a big part of the veterinarian's day-to-day. Key screen is definitely one of our crown jewels. And also vector-borne disease. We're also going to be really focusing on imaging, right? That's been one of the things that's been really exciting. And we're just sort of closing up this year's Antech Vet Girl imaging diagnostic certificate program. And so really proud of that and really excited to be able to speak with an outstanding speaker, Dr. Ken Waller at VMX, who will be highlighting things from sound powered by Antech, along with other parts of imaging. And then Holly, I know yourself and Diane Wilson will also be focusing on imaging and case-based setting. And again, really taking those cases from the pet owner, all the diagnostic options that are available to reach that diagnosis, and then again, preventive care. So how we work through screening to not just find and prevent disease, but also in a lot of ways give back to the profession, because as you guys have heard me talk about ad nauseum, it's not just the 4 legs, it's also the 2. So there are some One Health aspects of that as well. One of the other sessions I'm really excited about, and you're right, I don't really like, I'm more comfortable being behind the scenes, but I can kind of brag for him. Dr. Christian Lutnager and I also had a session accepted again this year for VMX's innovation track. And so we're going to be speaking about some of the innovations at Antech that I'm most excited about. And I'm also very proud about it, in part because I also get to work pretty closely with Dr. Christian Lutnager, who leads our R&D team and is responsible for so much wonderful innovation at Antech. And so our session will be on vector-borne disease PCR, molecular diagnostics specifically. And so that's another one that I'm pretty excited about bringing.
And I really appreciate you talking about the cases, how we bring it all together, right? Because I think there's that one direction where it comes from, that conversation in the exam room, right? Where we identify and uncover the problems. We ask these open-ended questions. We learn about the pet owner and some of their priorities and values. Then we work through our diagnostics based on some shared decisions, right? We tell them, and hopefully through our education platform, we try to show them the ways that we add our expertise as a reference lab and support in the practice, right? And whether that's through our rapid read AI feedback on their radiographs, right? So we can deliver that expertise in the point of care setting, offering both point of care analyzers and training and expertise around maximizing those diagnostics, as well as all of our reference lab offerings around diagnostics, right? Going to get the answer, right? And then additionally, you've always included some points about how we get back to the pet owner with these results, right? How we communicate them to make those shared decisions on the right treatment options, right? Because that conversation continues so bi-directionally, right? And I've always appreciated how comprehensive you've been in your education and the platforms that you've set me up for and those that I collaborate with, because I end up learning so much, right, as well with my partners. And so I think that you've done a great job of pairing mixed expertise, right? So it's myself as a clinical pathologist alongside a radiologist, right? And pairing together how those diagnostics intertwine, because it's usually not one or the other, right? But it's often both that lead to each other. But then also in being paired with, for instance, Dr. Jason Coe to speak about the communication aspect, because it really changed how I've communicated, right? So as a clinical pathologist offering consultation, I don't think I've historically given my customers, the veterinarians, choices, right? That I've given them what I think is sort of the top option or the ultimate of what the diagnostics that I think should ensue, but maybe that also giving them the options to better communicate those to the pet owners, because there's not only one choice, right, in these pathways. So I have learned so much in your comprehensive voice that you've developed. And then in addition, and I think that you could also speak to this, is how you pair our experts, right, with the voice of the customer through our professional service veterinarians. Do you want to speak to that?
Yeah, I'm really excited about it, and thank you for mentioning that. I think it's really powerful to have voices from the field specifically, right? Like you can use the term in the trenches, if you will. But I think none of us, at least for myself, one of the things that I've heard and I certainly feel is none of us want to go to an education session where we feel like somebody's talking at us, right? We want to feel like we're part of the conversation. I certainly do. And so one of the things that I've tried to do, and fortunately people like Tammi and Dr. Graham Bilbrough, as well as Dr. Jimmy Barr have allowed me to do this, is put on sessions that feel like a conversation, right? So multiple perspectives, as you mentioned. So sometimes two experts in a particular subject matter, like clinical pathology or imaging, but also really make sure that that voice of in the practice setting shines through. And so really excited to have someone like Dr. Jennifer Lopez up on stage. And I think this year, well, it's exciting to look back as Tammi led with and think about how long we've been, you and I have been putting these programs on at VMX really, and how we've grown. And it's allowed us to do things like start 3 years ago with a specific type of session and then evolve, as I think all good things should. And I'm really excited this year because along with those voices from the field that we're going to feature up on stage, is we're also doing something a little bit different, which is we're still trying to have those conversational type sessions, but we're also going to bring in something else that veterinarians have really been clear that they want, which is how do we marry the medicine with the business? And so the sessions really will be to provide information on that big, broad Antech toolkit from things like Keyscreen, Accuplex, True Rapid, vector-borne disease, like so much innovation along with the imaging portfolio, but also really speak through speakers like Dr. Craig Pryor and Rick Marenson about how do we take those things, communicate them in the practice setting, and get uptake in compliance. Because those are the things we've talked about before, that when you see veterinarians in education sessions, and I don't want to freak anybody out, but I am kind of watching you guys when you're there, is I see them take out their pens and pencils and start scrawling things down about how do I go back into the practice and have this conversation with a pet owner so that I can get them to say yes. I already have the why, or maybe you've just shown me a little bit more of the why, but I need the skills, the toolkit. And of course, that is very practical. And so that's exactly what we're going to be doing this year. And I'm super excited to see this happen. And I know we've got the experts that can do it. And so I'm super pumped about that as well.
I love it. And I think that you and I both will express our gratitude for Tammi, that we do have voice from the field, and it's you as a leader of our company, right? That as a veterinary technician, as someone who's been in this profession and in this industry for your career, right? That you bring that voice all the way up to the top and help it guide a lot of our principles and a lot of our work. So we are super grateful for your support for the education, knowing how effective it is, right, for our customers.
Thank you.
Yeah, and you never let us forget it, which I also appreciate.
I love it.
Easy when you hire experts like you guys. When you hire experts, like the two of you, it makes my job a lot easier because you know it too, and you've been there. So you're the first ones to raise your hand and be like, no, this is the way we should do it. And I'm like, yes, that's it. So you got to get the right people leading it from every single level. So I just appreciate the two of you and so many more that you mentioned that are involved in this, and how we bring this great content right back to the field from where it came from, because that's what they're asking us. Yes, exactly. I love it.
That's exactly right. Well, I thank you both for your leadership and your efforts that have brought these sessions and the tools that we deliver through them to life for Antech, certainly benefiting ultimately the pets, right? And our goal that we all stand behind the core purpose of Mars Pet Care to make a better world for pets. And we're all, I know, grateful to contribute to that. Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here.